Is there a cure or treatments for diabetes? There is no current cure, however, there are treatments for diabetes. Treatments for both types of diabetes are very similar with some slight differences regarding to insulin regulation. There are at least 20 types of insulin, and each differ on how they're made, work in the body, and how much they cost. Your doctor will determine the correct type of insulin for your health and lifestyle. First and foremost is to be able to keep a healthy diet and good amount of physical activity with regards to blood sugar levels. Like for everyone, the goal is to maintain a healthy lifestyle, except that diabetics must be more aware of this goal more so than those without diabetes. What are the treatment options for type 1 diabetics? For type 1 diabetics, they are required to use insulin whether through injection or by an insulin pump. There are several options for insulin delivery. By syringe is the most common method, but there are also the options of using insulin pens or an insulin pump. Insulin pens are similar to a syringe in terms that it uses a needle to inject the insulin. They look like fountain pens and can contain a cartridge of insulin or is pre-filled. Those with a cartridge or is pre-filled only contain one type of insulin. If prescribed 2 types of insulin, then patients must inject twice, one with each type of insulin. Insulin pumps are small devices that deliver insulin continuously throughout the day. Managing diabetes can be easier with the insulin pump as it is placed by somewhere on their person and can be adjusted for their lifestyles. The insulin matches their lifestyle rather than the diabetic working to match how the insulin is working. How exactly do insulin pumps work? Well, insulin pumps deliver short-acting insulin throughout the whole day by using a catheter placed under the skin. Short-acting insulin begins lowering blood sugar levels 30 minutes after injection. Doses are separated into 3 different categories: basal rate, bolus doses, and correction/supplemental doses. Basal rates are steady and continuous doses. Bolus doses are surges of insulin, usually during meal times or snacks. Correction and supplemental doses are to correct high blood glucose levels back to level before a meal. The placement of the pump can be based on preferences, such as attaching to a waistband, pocket, bra, or even a sock. What are the treatment options for type 2 diabetics? Healthy eating and exercise is the way to go for type 2 diabetics. However, pills and/or insulin may be prescribed to keep glucose levels low. Pills prescribed work best when coupled with meal planning and exercise, but depending on how long one has diabetes can determine if pills can help or not. If someone has been a diabetic for about 10 years, there is a likely chance that the medications will not work and they are on insulin because their pancreas gave out from overproducing insulin. Can diabetes be
Created using Powtoon.